The best eye response has 4 grades, starting with the most severe. The patient will receive a score of 4 when their eyes open spontaneously. The client will spontaneously open their eyes without having their name called, being touched or given a pinch. To receive a score of 3, eye opening to speech. The patient's eyes will open when their name is called. Kobe. The patient received a score of 3. To receive a score of 2, eyes open with response to pain. Patient responds to pressure on their nail beds, and then they receive a score of 2. For a patient to receive a score of 1, no eye opening, no response at all. Kobe, no response at all.
The best verbal response is on a scale of 5. The patient will receive a 5 if they are completely alert and orientated. Can you tell me your name?
Kobe.
Can you tell me where you are right now, Kobe?
In hospital at Ballarat Health Services.
Yep. And what day and month is it?
Wednesday, and it's May.
Great. The patient will receive a 4 if they are confused in answering but their speech is still intact. If one or more of the answers are incorrect, this will also result in a score of 4, confused. Kobe, can you tell me where you are?
I'm at home in bed and I need someone to help me get out of bed.
Okay, Kobe, you're actually at the hospital right now, so just stay relaxed and have a rest. The patient will receive a 3 if they use inappropriate words or jumbled phrases. This makes little sense in the context of the question, including the use of words rather than full sentences. Kobe, can you tell me where you are right now?
Christmas, monkeys.
You're actually at the hospital, so just lie down and relax. The patient will receive a score of 2, incoherent, if they just produce incomprehensible sounds, such as grunts or groans that are unrecognisable. Kobe, can you tell me where you are right now? Okay. If the patient is unable to produce any speech or sounds in response to speech or painful stimuli, they score a 1, no verbal response. Kobe, can you tell me where you are? Patient doesn't answer.
Rate of response is scored on a scale of 6. A patient will score a 6 if they can accurately respond to instructions. Nicole, can you please poke your tongue out? Localising pain scores a 5. This is when a patient responds to central painful stimulus. There are 3 methods of applying a central painful stimulus: supraorbital pressure, jaw margin pressure and the trapezius squeeze. Today I will demonstrate to you supraorbital pressure. Just below the inner aspect of the eyebrow is a small notch in which a branch of facial nerves run. The nurse's hand rests on top of the patient's head and the flat of the thumb is placed on the supraorbital ridge just under the eyebrow. Pressure is gradually increased for a maximum of 30 seconds. Withdrawal from pain scores a 4. In response to painful stimulus, for example, placing pressure on the nail beds, Nicole will bend her arms at the elbow as a normal flexion action, but fail to locate the source of the pain. Abnormal flexion scores a 3. This is when a patient presents with arms flexed inwards to the chest. The hands are clenched into fists and her legs are extended and feet are plantarflexed. Extension to pain scores a 2. It is characterised by straightening of the elbow and internal rotation of the shoulder and the wrist. Her legs are in full extension and feet are also plantarflexed. No motor response scores a 1.
So pupils are assessed on a neurological chart by their reaction to the light. So first you would look at your patient's pupils and assess them before doing your light test with the pen. So you would take note of the pupil size and record them on the neuro chart. The next step is to take your little light pen and take from the lateral side of your patient's face over to the nose and watch their reaction to light. We would then repeat that on the other side and note their constriction to the light. If there was any abnormalities between the two pupils, if one was more sluggish than the other, you would also document that, as well as the pupil size. If one was more abnormal than the other, you would probably draw that on the chart as well. If the pupils become unequal or one becomes more sluggish, it can be an indication of increased intracranial pressure, and you would need the doctor to review this as promptly as they can. If there is a positive reaction to light, you place a plus on the neurological chart. If the pupil is more sluggish, you put an S, and if there is no reaction at all, you would put a little minus sign on the observation chart. So the next test that we're going to do to test the neurological function of your patient is to assess the limb strength. First of all, we're going to compare the opposite sides of the body on the patient. So first I will ask the patient to grasp my hands and get them to squeeze as tightly as they can, noting any differences in the pressure between both arms. Normally the dominant side of the body is a little bit more stronger, such as the right hand or the left hand. Next I will ask the patient to lift their limbs simultaneously. So I would ask the patient to lift their right arm first, and then again with their left arm. Okay, and we'll do that with the right leg and left leg as well. So Kobe, could you please lift your right leg for me? And the left leg. So now what I'm going to do with you, Kobe, is just place some resistance on both those limbs and just test the strength. So could you please lift up one of your limbs for me? Excellent. I'm just going to place some downward pressure. Beautiful. And we're just assessing the strength in each limb. We'll do it on the other side. And again, noting any differences on the chart if there's any discrepancies between strength. Again with the limbs. Beautiful. And on the other side. Excellent. So if there was any discrepancies in strength on both sides, I would obviously note that on the chart as well. Next thing we do is with the feet. So we do dorsiflexion and plantar flexion. So if you could plantar flex your feet, just point them down for me. Excellent. And dorsiflex, so just point them up to the sky. And I'm just going to apply some resistance to that as well. So if you could push against my hands. Excellent. And again upwards. Beautiful. So again, we would record that if it was any different. So strength can be classified on the neurological chart as normal power, mild weakness, severe weakness, flexion, extension, and no movement at all. Hi, my name's Alana. I did pupil assessment and limb strength. I believe that I could have maybe explained it a little easier to the patient to increase their understanding. Instead of saying dorsiflexion and plantar flexion, I could have just told them how to point their feet, and that may have got a better result from that one.
Hi, my name's Shana. I demonstrated best verbal response.
I think that I could have tried to mix up the questions a bit, and just to make sure that I need to consider whether the patient is from a different culture, whether there's language barriers or they have sight and hearing difficulties. So just all of those options need to be considered with the patient.
My name is Nicole Forbes and this is my reflection. My part of the YouTube presentation was best eye response. I felt like with the time constraints that I don't know if I explained it properly, plus just explaining it clearly, just talking to the patient, I don't know if I was loud enough and clear enough, and with doing the pressure on the nail beds, if to get the actual pressure, if that was strong enough, it was hard enough for the patient. Other than that.
My name's Kobe Castleman. This is my reflection. My part in this YouTube presentation was best motor response. Due to the time constraint of 10 minutes, I feel that I could only skim the surface of best motor response. If there was a longer time frame on this assignment, I could have explained what the nurse should expect in greater detail with each level. For instance, level 6, it is recommended the nurse have the patient to obey 2 commands instead of 1. Level 5 states that a painful stimulus should be applied only when the patient shows no response to the verbal instruction and need not to be applied if the patient is already localising. I could have gone on further to say that to be classified as localisation, a patient must move the hand to the point of stimulation in an obvious coordinated attempt to remove the cause of pain. At this level, I only had time to demonstrate the supraorbital pressure. There's 2 other pressures I could have demonstrated. One was the jaw margin pressure and the trapezius squeeze. The jaw margin pressure is applied to the angle of the jaw. The trapezius squeeze is across a muscle, it extends across the back of the shoulders and you squeeze that muscle for about 30 seconds. And because we only had 10 minutes, I couldn't demonstrate this to you. With level 1, before recording no response, I should have ensured that adequate stimulation had been applied and demonstrated this to the viewers. It would have been good to have an extra person throughout this recording as a patient. It would have been more effective and consistent with the patient not swapping and changing all the time if we just had one person focused on this area. But I feel that we all worked hard as a group really well, we contributed equally, and like I said, we could have gone into more detail if there was a longer time frame. And this is my reflection.